Good morning. I'm Dr. Sham Kumar, Senior Consultant ENT, Head and Neck Surgeon here at Apollo Main Hospital, Chennai. Today I'm here to talk to you about a topic that is close to my heart, that is cochlear implant. Cochlear implant is what we call as akin to bionic ear. It's a conduit. It's used in a very last stage condition with regards to hearing. We see a lot of children or adults who have very severe hearing losses, wherein even an external hearing aid does not work. So in that sort of desperate situation, especially in a child where speech language development can be severely affected and their life can be affected very badly, cochlear implant can really change the life of such a patient. When it comes to adults, we look at senior citizens or other people who have for some reason lost hearing, say meningitis or head injury or various other reasons. So when they have such sort of hearing loss, so what needs to be done many times is nowadays in many corporate hospitals or bigger hospitals, newborn hearing screening is done to check the hearing of the child as soon as it's born. So that is very important. So there are various ways of doing this. We do a test called OAE. There's a test called BERA. So whatever test is done, first we have to see whether the child is pass or fail in that test. In case the child fails the test, then we need to do a reassessment. Sometimes there are risk factors for which we need to be looking at, especially prematurity, low birth weight, if there is jaundice after birth for a long time, or if any exchange transfusion is done, or for jaundice, any light therapy or phototherapy is done, and any NICU care is there. These are all risk factors for child losing the hearing. And if there's family history of hearing loss, and then this sort of hearing screening needs to be done. So when this hearing screening is done and child fails, we do a reassessment maybe 3 months or 6 months again, and then we do more comprehensive assessment of hearing. And if such a child repeatedly fails all the tests, then we look at why the child has developed hearing loss. One way of looking at it would be to look at the structure of the inner ear and the hearing nerve and the brain. So to that effect, we do a CT scan, MRI scan to see the structural problems. So in case there are no other issues and we find that the STR, the structures are there, but then they are not working properly, and then by doing the various audiological tests, we come to a conclusion that cochlear implant may help the child. So it could be done at an earlier stage, especially if the child has a profound hearing loss. In adults, like I said, when we find this sort of hearing loss is there and we would want to rehabilitate them for reason so that their cognition doesn't go down, that we can prevent dementia and other problems. And nowadays we see many senior citizens who are alone at home or they don't have anybody else to take care of them. So their need for sound awareness and their own self-awareness is also very important, and they need to communicate with people around them, their neighbors and maybe servants or something. Without that, their safety also would be compromised.